Which color of light is most commonly used to treat neonatal jaundice? Red, blue, green, yellow. The correct answer is option B. Blue color of light is most commonly used to treat neonatal jaundice. What is the first stool of a neonate called? Colostrum, meconium, chyme, feces. The correct answer is option B. The first stool of a neonate is called meconium. Which of the following medicines is useful for reducing raised intracranial pressure? Mannitol, amoxicillin, paracetamol, none of these. The correct answer is option A. Mannitol medicines is useful for reducing raised intracranial pressure. Following a severe head injury, the main cause of death is often due to injury to which part of the brain? Injury to the pons, injury to the medulla oblongata, injury to the midbrain, injury to the thalamus. The correct answer is option B. Injury to the medulla oblongata. The drug that prevents and stops nausea and vomiting is known as an analgesic, antiemetics, antipyretics, antibiotic. The correct answer is option B. The drug that prevents and stops nausea and vomiting is known as an antiemetics. How much blood can an average adult donate in a single blood donation? 250 milliliters, 450 milliliters, 750 milliliters, 1 liter. The correct answer is option B. 450 milliliters. What is the secretion from the mother's breast following delivery called? Amniotic fluid, colostrum, lactase, progesterone. The correct answer is option B. Colostrum. Curing signs is positive in which of the following conditions? Osteoarthritis, meningitis, multiple sclerosis, lumbar disc herniation. The correct answer is option B. Curing signs is positive in meningitis conditions. Which of the following medicines can be used to suppress lactation after delivery? Oxytocin, bromocriptine, estrogen, prolactin. The correct answer is option B. Bromocriptine medicine can be used to suppress lactation after delivery. Which vitamin is needed for the prevention of hemorrhagic disease of a newborn? Vitamin A, vitamin B12, vitamin C, vitamin K. The correct answer is option D. Vitamin K is needed for the prevention of hemorrhagic disease of a newborn. Severe blood loss can lead to which of the following conditions? Hypervolemia, hypovolemic shock, hemoconcentration, hypertension. The correct answer is option B. Severe blood loss can lead to hypovolemic shock conditions. Hormone replacement therapy is associated with increased risk of osteoporosis, increased risk of breast cancer, decreased risk of cardiovascular disease, increased muscle mass. The correct answer is option B. Hormone replacement therapy is associated with increased risk of breast cancer. Which part of the human stomach connects with the esophagus? Fundus, body, pylorus, cardia. The correct answer is option D. Cardia part of the human stomach connects with the esophagus. Which type of burn is typically painless? First degree burn, second degree burn, third degree burn, fourth degree burn. The correct answer is option C. Third degree type of burn is typically painless. Which structure establishes a connection between the fetus and mother during intrauterine life? Amniotic sac, placenta, umbilical cord, none of these. The correct answer is option B. Placenta structure establish a connection between the fetus and mother during intrauterine life. The sunset sign is typically seen in which of the following conditions? Appendectus, hydrocephalus, spinal muscular atrophy, cerebral palsy. The correct answer is option B. The sunset sign is typically seen in hydrocephalus condition. Which of the following best describes dysuria? Frequent urination, painful urination, urinary incontinence, urine retention. The correct answer is option B. Painful urination. Which of the following medicines is used in the treatment of organophosphorus poisoning? Atropine, insulin, paracetamol, amoxicillin. The correct answer is option A. Atropine medicines is used in the treatment of organophosphorus poisoning. Nelson syndrome is typically seen after which of the following conditions? Pituitary adenoma removal, adrenal gland removal, Cushing disease, appendectomy. The correct answer is option B. Adrenal gland removal. Which vaccine is contraindicated in a child with a history of convulsions? MMR, DPT, IPV, BCG. The correct answer is option B. DPT. In the case of hypothyroidism, which of the following typically increases? Thyroid stimulating hormone TSH, thyroxine T4, calcitonin, serum calcium. The correct answer is option A. Thyroid stimulating hormone TSH. What is the most suitable position for administering an enema? Front position, sitting upright, left lateral position, supine position. The correct answer is option C. Left lateral position, lying on the left side. Diphtheria is primarily spread by which method? Contaminated food and water, direct contact with skin lesions, airborne respiratory droplets, insect bites. The correct answer is option C. Airborne respiratory droplets. Which of the following genetic disorder is caused by the presence of an extra copy of chromosome 21? Turner syndrome, Hansen disease, Down syndrome, Edwards syndrome. The correct answer is option C. Down syndrome. In which condition is projectile vomiting commonly seen? Megacolon, pyloric stenosis, appendectus, peptic ulcer disease. The correct answer is option B. Pyloric stenosis. Fever with bradycardia is commonly seen in which of the following conditions? Influenza, typhoid fever, pneumonia, meningitis. The correct answer is option B. Typhoid fever. Which of the following vaccination is recommended for pregnant women to protect both the mother and the newborn? MMR vaccine, DPT vaccine, HPV vaccine, pneumococcal vaccine. The correct answer is option B. DPT vaccine. What is the term for the care of a mother during pregnancy? Postnatal care, antenatal care, infrapartum care, pediatric care. The correct answer is option B. Antenatal care. International Nurses Day is celebrated on which of the following dates? April 7, May 12, June 14, September 25. The correct answer is option B. May 12.